Okay, so today we're diving into something I bet you're familiar with, at least familiar with the symptoms, UTIs.
UTIs.
Ever
Yeah.
get that like sudden urge to pee?
Right.
But when you do, there's that not so pleasant burning sensation.
Yeah, I know what you mean.
That's often how a UTI, a urinary tract infection,
Yeah.
lets you know it's there. And you sent us some really interesting material about UTIs.
Yeah.
Yeah, it looks like we've got a video script here aimed at a general audience. So our mission today is to go through it, find those key takeaways, and help you, the listener, understand UTIs even better, especially when it comes to preventing them.
Sounds good. UTIs are definitely a common health concern, so let's jump right in.
For sure. The video starts by breaking down exactly what a UTI is. And it turns out it's not just one thing.
Yep.
It's an infection that can happen anywhere in your urinary system.
Right. And that includes your kidneys,
Kidneys, okay?
your bladder,
Bladder, ureters.
ureters, got it.
And your urethra. Okay, so that whole system. But the video says most UTIs usually hang out in the bladder and the urethra.
Makes sense.
Yeah.
Yeah.
I mean, those are the parts dealing directly with the urine. So kind of the front lines, I guess. But why are UTIs so common? Especially, video says, in women.
Well, it's mainly because of anatomy. Think about the urethra. It's the tube that carries urine from the bladder out of the body. And in women, that urethra is shorter.
So the bacteria have a shorter distance to travel.
Exactly. Shorter distance to travel to cause an infection.
That makes sense. And speaking of bacteria, the video keeps mentioning E. coli.
Oh, yeah, E. coli.
Is that the same bacteria that can make you sick from, like, undercooked meat?
Same one. It's crazy, right?
Yeah.
Some bacteria are totally harmless in one part of the body, but cause issues in others. E. coli normally lives in your gut, no problem. But if it gets into your urinary tract, uh-oh.
Party foul.
Exactly.
Okay, so how do you even know if it's a UTI? Like, how do you tell if you have one and it's not just, you know, a weird day?
Good question.
The video talks about that burning sensation when you pee.
Yeah, the classic burning.
Ugh, that sounds awful.
It is, and that burning is a sign of inflammation. It's your body's immune system fighting the infection.
Oh, okay, so that's what's causing that. I see.
You might also feel like you constantly have to pee, even if just a little comes out.
No, I've definitely felt that before.
Right. That's because the infection makes the bladder irritated, making it feel full even when it's not.
Got it. And what about, like, when it gets more serious? The video mentioned things like back pain, fever, chills.
Yeah, if you have those, that's a sign the infection might have spread to the kidneys. That's serious. Much more serious. You need to see a doctor right away.
So, okay, we've talked about what UTIs are, the symptoms,
Yeah.
and why they're more common in women. But who else is at risk? The video mentions a few things.
Right. So sexual activity can increase the risk, as can certain times in life like pregnancy
Uh-huh.
and menopause.
Right.
Even something simple like holding your pee for too long, that can make you more susceptible.
Really? Just holding it in? I mean,
Yeah.
the video said that, but does that really make a difference?
It does. Holding your urine gives the bacteria more time to multiply in the bladder, and that increases the chance of an infection.
Oh, wow. So you're basically giving the bacteria a free pass.
Yeah, basically, you're letting them set up camp.
Interesting. And the video also really stresses good hygiene,
Yeah.
especially for women. Is that connected to the microbiome, you know, that community of bacteria we talked about before? It feels like there's a connection there.
There is, absolutely. The urinary tract, just like the gut, has its own little world of microorganisms. And keeping a healthy balance is important. If you disrupt that balance with things like harsh soaps or douches, you make yourself more vulnerable to UTIs.
Wow. So, like, maintaining a healthy microbiome down there is just as important as it is, you know, in our gut.
Exactly. Think of it like maintaining a healthy ecosystem. We want the good bacteria to thrive, to keep the bad ones in check.
Okay, that's fascinating. So, about keeping things in check, the video has some really practical tips for preventing UTIs. Like staying hydrated, not holding it in like we talked about, peeing after sex.
Right.
Seems like those simple habits can make a big difference.
They really can. You're basically making an environment where those UTI-causing bacteria are less likely to thrive.
So we've covered the basics of UTIs, why they happen, who's at risk, and some key prevention strategies. But what if, even with all that, we still end up with a UTI? What happens then?
Well, the video really stresses if you think you have a UTI, see a doctor.
Makes sense.
Mild cases, they might just clear up on their own, lots of fluids and rest. But most UTIs, they need antibiotics. Gets rid of that infection.
Okay, that makes sense. But what about, like, people who are kind of wary of taking antibiotics, or people who get UTIs all the time, like recurring UTIs.
Mhm.
The video doesn't really talk about that too much.
Right, that's a really good point, and a lot of people worry about that. Antibiotics, yeah, they usually work,
Mm.
but they can mess with your microbiome, that balance of bacteria. Sometimes you get other issues like yeast infections. And for people who keep getting UTIs, it's just frustrating.
Totally. So are there other things you can do? Like, I know the video mentioned cranberry juice, but like, does that actually work? I've always wondered.
Cranberry juice, yeah, that's a popular one. A lot of people swear by it, like a home remedy.
Mm.
But the science, it's a little iffy. Some studies, they say certain things in cranberries might stop bacteria from sticking to the walls of your urinary tract, so it's harder for them to cause an infection.
Yeah.
But more research is needed.
I was like, maybe it works, maybe not.
Yeah.
Okay. What about other options? The video mentioned D-mannose. I have no idea what that is.
D-mannose. Okay, so it's a type of sugar naturally found in some fruits. Cranberries actually have some, and it's thought to work kind of like cranberries, stopping the bacteria from sticking. There's some research showing D-mannose supplements, they might help prevent UTIs, especially for people who get them a lot.
Interesting. Okay, so we've got cranberry juice, D-mannose. Anything else, like anything new being developed? I'm thinking, long-term solutions. Like, could there be a vaccine for UTIs? Is that even possible?
That's actually a great question. It's not as crazy as it sounds. Scientists, they're working on UTI vaccines, and the early results, they look good.
Wow.
But it's going to be a while, probably several years, before there's a UTI vaccine everyone can get.
Yeah, but that'd be amazing, right? Like a total game changer for so many people.
Yeah.
So for now, it sounds like the best bet is those good habits from the video. And maybe trying things like D-mannose.
Exactly. And don't forget, everyone's different. What works for one person might not work for another. The best way to figure out what will work for you, for prevention or treatment, is to talk to your doctor.
That makes sense. Now, this video, it's all about preventing UTIs. But what about when you already have one? Especially those recurring UTIs. How do you break that cycle?
That's where understanding the microbiome, like we were talking about, it becomes really important. Sometimes when you take those antibiotics, yeah, they kill the bad bacteria, but they can also upset the balance of good bacteria in your urinary tract.
So it's like you're solving one problem, but maybe creating another one.
Yeah, it's a bit of a double-edged sword, and that's where those other approaches come in, like probiotics and D-mannose. They can help restore that balance, make you less likely to get infections in the future.
Okay, so probiotics. We usually hear about those for gut health. Do they work for the urinary tract too?
Yeah, there's some research suggesting certain probiotics can actually help prevent UTIs. Like there's one called Lactobacillus rhamnosus and another Lactobacillus crispatus. They've shown some promise in studies. They kind of crowd out the bad bacteria, keep things healthy down there.
So does that mean like just eating yogurt with probiotics will do the trick?
Well, not quite. Scientists still need to do more research to figure out, which strains work best, how much you need and all that. Supplements, those are an option too. But talk to your doctor. Figure out what's best for you.
Okay, so we're arming ourselves with knowledge, thinking about the microbiome, exploring those alternatives. What else can we learn from this video about dealing with recurring UTIs? So this video, it mostly talks about UTIs in women,
Mm-hmm.
but it does mention that men can get them too.
Yeah, they can.
What's different about UTIs in men?
Well, it's important to know the differences, right?
Yeah.
Like we were saying, anatomy plays a big part.
Right, yeah.
Hmm.
We talk about the shorter urethra in women makes them more susceptible. So basically, men are less likely to get them because their urethra is longer.
Yeah, you could say that. That longer urethra in men, it's a better barrier, helps keep the bacteria from reaching the bladder.
Okay. But what about the symptoms? If a man does get a UTI, are they the same as in women?
Mostly, yeah. The signs, they're pretty much the same. Burning when you pee, always feeling like you gotta go. Maybe your pee looks cloudy or smells kind of strong.
Okay, yeah. But is there anything, I don't know, any subtle differences?
Maybe. Men might have some pain or discomfort in the prostate area.
Oh, right. Yeah, that makes sense. The prostate is right there.
Yeah, it's part of the urinary system.
Okay, got it.
Yeah.
So basically, if a man thinks he has a UTI, same advice applies. See a doctor right away.
Absolutely. Catch it early, treat it early. That's the best way to prevent complications, just like in women. And for men, it's especially important to make sure there isn't a prostate problem.
Yeah, right. Because those can feel like UTI symptoms sometimes.
Exactly.
So we've talked about preventing UTIs, like staying hydrated, good hygiene, not holding it in. Is there any advice specifically for men?
Well, the general stuff, that's still important for men too. Stay hydrated, flush those bacteria out. Good hygiene keeps the germs from spreading. Empty your bladder all the way when you go. That way the bacteria don't have a chance to multiply.
Okay, so the basics are the same for everybody,
Yeah.
but I don't know, is there anything extra men should know? Like, the video didn't really go into detail there.
Well, think about this. As men age, sometimes the prostate, it gets bigger, and that can push on the urethra, making it harder to, empty your bladder completely.
Oh, okay.
And that can, well, it can make it easier for bacteria to grow, increases the risk of UTIs.
So it's important to pay attention to, like, any changes in how you pee as you get older?
Definitely. If you notice, I don't know, it's hard to start peeing or stop peeing, or you feel like you didn't really empty your bladder all the way,
Hmm.
those could be signs of a prostate issue. You should get that checked out. It's always better to be safe than sorry.
That's great advice. So to wrap things up, it sounds like UTIs, yeah, more common in women, but definitely something men shouldn't just ignore. Understanding the symptoms, knowing what puts you at risk, and how to prevent them. That's key for everyone.
I totally agree. And the most important thing, man or woman, if you think you have a UTI, talk to your doctor. Early treatment, that's how you avoid problems and get back to feeling good.
This has been so interesting. UTIs, I feel like I know so much more now. We've covered everything. The basics, preventing UTIs, the microbiome, what to do about recurring infections, even the differences between UTIs in men and women.
That's great, right? Knowing more, it helps you stay healthy.
For sure. To our listener, thanks for sending this video script. We hope this deep dive has given you some useful information, maybe even some aha moments.
And hey, if you have more questions, talk to your doctor. They're the best resource.
Absolutely. Stay hydrated, stay informed, and take care of yourselves. That's a wrap for our deep dive into UTIs. Thanks for joining us.